Hey guys, happy Saturday. Happy Saturday. If anybody is on here, I can't oh yeah, I can see the number now. I can see that people are watching. Happy Saturday, guys. Let me know where you're watching from. I'm gonna get ready to get started. As I promised, I will be going live every single day of this month. And we're going to get right into it. Let me know if you are watching. Let me know where you are watching from. Good afternoon. It is Saturday. At the time of this video, it is 6:05 p.m. Eastern Standard Time. Hey, Daphne. Oh, that's awesome to know. Okay, Daphne says the videos are helping. I'm so glad to know, Daphne. I'm so happy to know they are helping you. So we're going to get into these abbreviations. I'm going to go over some common abbreviations. Hey, Deshauna. I'm going to go through some common abbreviations that you need to know for your certification exam. And this is whether you are taking the CCMA, the RMA, the CMAA, the CMA AAMA. Like, this is foundational information for all of the certification videos. Hey, Tanya from Alabama, Yvonne from Orlando, Florida, Melanie from Boise, Idaho. So we're going to get ready to get started. If this is your first time joining live, the way I do it, I go to each slide and then I give you guys a couple minutes to put in the correct, well, to put in the answer in the chat, and then I'll go to the next slide and let you know if you got it correct or not. Hey, Nanalina. All right, guys, so we're going to go ahead and get started. Let me remove this banner here. And simply, you're just going to write in the comments what the answer is. And then if you get it incorrect, it's okay. That's what we're doing this for. We're doing practice. RHIA. What is that? What is RH? Is that which one are you asking about, Daphne? You saying RHIA? Are you saying that is that an exam, or are you referring to that as a oh, are you referring to RHIA? Is that Registered Health Information Administrator? Now, if that's what you're referring to, I'm not too familiar with that. Oh, yep. Okay, Registered Health Information Administrator. So, I mean, it's terminology, so it's foundational information. However, that is a more advanced degree. That is a more advanced test. But terminology is foundational information for anything healthcare related. However, that's about as far as this is going to go. It's helping with some of that foundational information. All right, so we're going to go ahead and get started. CHF. What is CHF? No problem, Daphne. Yes, congestive heart failure. I see you guys are putting it in the comments. Congestive heart failure. So, a person who has congestive heart failure, their heart is not pumping blood well enough so that it's able to supply the body with what it needs. So, you guys know every time the heart beats, it's pumping blood throughout the body. With congestive heart failure, it's not pumping sufficiently. And this can be caused different reasons. It can be from an infection, it can be an injury, it can be, maybe a patient has had a heart attack, it could be a blood clot. It's different reasons why, and some of the symptoms a person may have, they may have shortness of breath, swelling. Some people even experience cough and loss of appetite. CVA. Cerebrovascular accident, aka a stroke. Cerebral vascular accident, aka a stroke. Now, one of the things you'll need to know about stroke for certification is some of the symptoms. So the patient may have slurred speech. They may have, oh, I just realized I accidentally paused this. They may have slurred speech. They may have droopy, one side of their face may be droopy. The arm may be droopy. They may have tingling or numbness in their arms. Um, TIA. What is TIA? TIA. Hey guys, let me know if you are still with me. I don't know. It looks like something is freezing on my end. Do me a favor and confirm you can still hear me and see my screen. For some reason, the chat is freezing. I can't see anything else anymore. Something is going on. Let me know. Then again, if you let me know, I won't even be able to see it. For some reason, let me go out of here on my phone and come back in. I'm not able to see anything. Okay, Nicholas says yes. Okay. Okay, Daphne said yes, I can hear and see. Okay. And you guys can see my screen? Okay, good. Okay, so that was CVA. TIA is what they call a mini stroke. So that's a transient ischemic attack. So that is a mini stroke. CXR. Chest x-ray. Chest x-ray. Yep, chest x-ray. QD. What does QD mean? QD. Every day. What is QOD? What is QOD? So QD was every day. What is QOD? Yep, QOD is every other day. BID. Yep, twice a day. TID. And the way they may ask you on an exam question, they may just say something like, Mary Johnson has to take metoprolol. Well, no, I'm not going to say metoprolol because, well, yeah, because there might be something. No, you don't really take metoprolol 3 times a day. So let's say Miss Murray Johnson has to take maybe, ibuprofen for her pain 3 times a day, right? And instead of saying 3 times a day, it'll say TID, and you'll need to know that the prescription is for is for 3 times a day. And it may even say PRN TID. And I just realized I did not include PRN in this lesson. That is crazy. PRN means as needed, guys. But they may say something like that, like she has to take it TID PRN, and that just means 3 times a day as needed. And when they add, of course, the as needed, the PRN, that means that the patient only takes it when they need it. They don't necessarily have to take it 3 times a day, only if they need it. All right, QID. Now, a lot of people get QID and QOD mixed up. QID is 4 times a day. And then, like we said, QOD was every other day. QH. QH is every hour. CC, all my clinical medical assistants, I know y'all know what this is, even if you're still in school. Chief complaint. That is the main reason the patient is in today. That is what the patient is in today. So you'll ask your patient, so what brings you in to see the doctor today? And what they tell you is the chief complaint. Oh, I hold on, guys. I made a mistake. I accidentally deleted my CO. Wait a minute. Let me fix that. So now you guys see what the answer to the next one is. Oh. Sorry, y'all. Because what happens is the way I create my slides, I go through with the questions. I make all the questions first, and then I go back and then I add the answer. So I must have just, instead of duplicating a slide, I must have just typed in complaining of instead of duplicating it first and then doing it. So yeah, as you can see, CO is complaining of. All right, PHI. Yep, protect the health information. Protect the health information. And if anybody can like put in a chat, what is an example of protect the health information? Because that is something they'll ask you. They'll list, of course, four options, and they'll say which of the following is an example, or they may say all of the following is an example of protect the health information except. So just make sure you know examples. I'll tell you something that's not PHI. The name of the doctor is not PHI. Of course, the patient's appointment time is not PHI. So just make sure you know those examples, and somebody can put it in the chat. Just give us some examples. I just want to make sure you guys know some examples of PHI, because you will see it on the test. Yes, definitely reason for the visit. Any type of information that reveals the patient's diagnoses, everything about you, like your demographic information. Exactly. All right. FH. You're welcome, Helen. Congratulations. And guys, I see you guys writing in the comments too. I'm sorry I can't get to everybody letting us know you passed, but everybody that's writing in that they passed, congratulations. I just try not to stop while we going through the lessons to congratulate everybody, but I definitely will at the end. So if you put a question in the chat, or if you put in anything, you've passed anything like that, I would definitely address it at the end. Family history. PH. PH is past history. Why am I, yeah, I'm just making all kinds of mistakes today. What, y'all, charge it to my brain. I've been doing too much. Let me fix this. Sorry about this, y'all. I done duplicated it. I mean, I done wrote in social history without duplicating the slide first. Sorry, y'all. I'm glad y'all don't judge, because y'all don't care. Y'all don't mind if I got to do this. Let me switch that over there and then present that. Okay. That's what it's supposed to be. It's supposed to be SH. What is SH? Y'all already saw it. It's social history. It's social history, right? So, what are some things that go in social history? And that is something they may ask. I'll give you some examples of some things that need to go in social history. Somebody give me some examples of social history, the social history section of the medical record. And I'm just showing you guys here just a quick interlude to show you guys my online study guide for anybody that needs some extra help, right? I have practice tests in here, lessons that I've created myself. I go through just like I'm teaching you guys here in those lessons. I go through, teach you guys a lesson, and then I give you a quiz. You do get a score. And then at the end, there are practice test questions as well. So there's over 400 and something practice questions all together in my online study guide. So that's that at marefreshercourse.com. Okay, yep. Social history includes drinking. Sorry, guys, my phone is ringing. My daughter is FaceTiming me. Hold on one moment. Let me mute this for 1 second. Okay, let's see. BP is blood pressure. DX, what is DX? Hey, Crystal, I'm glad you finally caught it live too. Diagnosis. What is HX? HX is history. If you put history, you are correct. What is SX? SX is symptom. CO2. CO2. Carbon dioxide. O2. And y'all excuse all of the interruptions today. Y'all know it's a Saturday. Listen, this is very informal, and my daughter, she's in college. She's out in Ohio. She's like 7 hours away from me. So when she FaceTimes me, which is not very often anymore, I gotta answer to make sure everything is a-okay. My baby is left home. She's 7 hours away. So I gotta make sure she's okay. Oxygen, yep. SpO2. Oh man, this may be another typo. I don't remember writing the answer to this one. Hopefully I did. Okay, I did. Oxygen saturation. Oxygen saturation. So when we're checking the SpO2, we're checking how much oxygen is in the blood. That's why we put the little pulse oximeter on the patient's finger. We're checking for the SpO2. PT. All right. So depending on how it's used, PT can mean a few different things. PT refers to patient. PT can also refer to physical therapy. So it depends on how they're asking. So of course we know we abbreviate patient PT, but then if the question is saying something like, the patient has injured her leg, like, or fractured her leg, like what specialty would the patient be referred to, right? And you see PT in that sense, PT would be considered, they would be talking about physical therapy in that sense. And if they're talking about lab work and you see PT, then they're referring to prothrombin time. Or you may see PT and PTT. Okay, so PT and PTT refers to prothrombin time and prothrombin plastin time. And those are clotting tests. So those are tests that test for clotting time, how fast the patient's blood clot. Okay, the blood clots. Okay. So PT again can mean several different things. So it depends on how it's being asked. NKA. No known allergies. Yep. No known allergies. What is NKDA? And one of the reasons we write NKA if a patient says, no, I'm not allergic to anything, we write no known allergies because, you know, they very well can have an allergy and just don't know it. That's why we, instead of just putting no allergies, we put no known allergies because they could have some, but they don't know of any. And then NKDA is no known drug allergy. So make sure when you're asking your patients, are they allergic to anything? Make sure you're specifying, do you have any allergies, any food allergies, any medication allergies, like, any allergies? Because sometimes if you just say, do you have any drug allergies? They'll say no if they don't have any drug allergies. But what if they're allergic to bee venom, right? They may not think to mention it if you specifically ask, are you allergic to any medication? So make sure when you're asking your patients if they have any allergies, make sure you're generalizing. Do you have any allergies at all? Food, drugs, seasonal, like anything. UA. UA is urinalysis. RX. And do me a favor, guys, while y'all watching, if this is helping, do me a favor and like that video so it can be pushed out more to more people and I can help more and more people. Yep. RX is prescription. Prescription. Yep. Make sure you guys know the parts of a prescription too. For my clinical medical assistants, make sure you know those parts of a prescription. Okay. LMP. Congratulations, Sarah. LMP is last menstrual period. So when you have female patients, you gotta ask. Well, depending on where you work, because if you're working like in orthopedics or you're working in, cardiology, they're not really worried about the last menstrual period. So, but if you're working, family practice and especially GYN, you want to ask for the first day of the last menstrual period, the first day, because that is when the cycle starts. AC, and this is not air conditioner. AC is before meals. PC. Hi Kiki, I see you said you test Monday. No, I don't have any flashcards or Quizlets or anything. The only thing that I have like that's just accessible and free are these YouTube videos. I do have a study guide that I created that is for purchase at marefreshercourse.com, but that's about it. I don't have any like Quizlets or anything like that. Just these videos and then my online study guide, and that's marefreshercourse.com. After meals. HS. And I do plan on creating some downloadable flashcards. Those will be something that I will also I'm just going to create a bunch. I'm going to create some medication flashcards. Like I'm going to just create a bunch of little like cheat sheets and stuff like that. Now, they won't be free. They'll be something very affordable, like $9.99 or something like that. But they'll be on my website as well. So that way, for people that don't want to purchase the entire study guide, because like I mentioned, that study guide has lessons in it. So you may be someone that says, I don't really need all the lessons. I just want something that I can read over, because maybe you're someone that just wants something tangible that you can just read over. So I'm going to create something like that as well. Yep, HS is bedtimes. I said bedtimes. Bedtime. DC, D/C. Let me check on my Facebook people. Hey, Deidre. Deidre been hanging in there these last few days. Hey, Deidre. Okay. So DC, depending on how it's being used, can be discharge, and it can also mean discontinue. So if a provider is writing, patient is to DC, metoprolol 50 milligrams, they're saying that the patient is to discontinue. Then of course, if it's saying patient is, presents for D/C, then that means that they're present for discharge, right? So it depends on how it's being used. Just like we mentioned about the PT. SOB. SOB is shortness of breath. Yeah. PVD. PVD. Yep, peripheral vascular disease. Now, what is PAD? PAD is peripheral artery disease. Okay, now let me just say this. So, PVD, peripheral vascular disease, is kind of like an umbrella term because PAD is a type of vascular disease, but with PAD, peripheral artery disease, it is specifically affecting the arteries. The arteries are narrowed and stenosed, as we learned stenosis the other day, right? The narrowing. So the arteries are stenosed, and oxygen is not able to get to the rest of the body. So remember, every time the heart beats and the arteries take blood away from the heart. So with peripheral artery disease, the oxygen is not able to reach the rest of the body, right? With PVD, that affects that can mean any of the blood vessels. Really, it's more of an umbrella term. And usually when they say PVD, they're usually referring to the veins. So with PAD, the arteries are affected. With PVD, it's a general term, as I mentioned, that refers to any of the blood vessels, but PVD is also referred to as peripheral venous disease, which affects the vein, meaning the veins are stenosed. PO. Oh, you know what? Somebody put pulmonary artery disease. Oh, yeah, also pulmonary artery disease. Thank you for mentioning that. Yep, also pulmonary artery disease. Thank you for mentioning that. I forgot all about that. I need to add that to the slide. Also pulmonary artery disease. That's a good one, Sonya. Tiffany said, Deidre, I need to add you as my study partner. I know, right? Deidre be on it. Deidre, where are you in school, or are you already working, or what? Where are you in your process, Deidre? Because you are often on it with these medical terms. Yep, PO is by mouth. What is NPO? Yep, nothing by mouth. Nothing by mouth. MI, what is MI? One thing too I want to mention about NPO and fasting, you may be asked about the differences between fasting and NPO. So with fasting, we know that that means that the patient has to, withhold from food and drinks for a certain amount of time, right? But they can usually still drink water and they can still take their medications unless they're having some type of procedure where they have to hold certain types of medications. But generally, when patients are fasting, they can still drink water and take their medicines. With NPO, they can't have anything by mouth, nothing by mouth. MI is myocardial infarction, aka heart attack. What is MMHG? What does that mean? What is that referring to? MMHG. MMHG. So this is millimeters of mercury. This is millimeters of mercury. And this is the unit in which we measure blood pressure. Like if you guys look at your blood pressure cuffs, your sphygmomanometer, you see the mmHg. That is the unit in which we measure blood pressure. mmHg refers to millimeters of mercury. GM. And GM is not good morning or general manager. GM is gram. Yep. What is GR? Let me let Nana hold on. Let me type something in the chat real quick. Fast forward the video. Okay, I had to let her know to fast forward because she's a little behind. So the answers that she's putting in the chat are way off. Okay, so GR is grain. So GM is gram, okay? But GR is grain. Oh, she said I was driving. Oh, got you. Be careful, Nana. Be careful. Please be careful. What is MM? And then, Nana, if you want to get ahead, you can just hit the red button and then slide it forward so you can be where you need to be. Yep, mm is millimeter. What is cm? Cm, centimeter. Centimeter. Yep. What is ml? ml is milliliter. Okay. One thing I want to point out too, I meant to mention when we were on the gram, you know what? I did not include mg. Let me add mg on here, guys. I want to add mg. Let me go back. Let me add mg because I do want to point out this too, guys. Y'all know that milliliters, that refers to liquid, right? So anytime you have milliliters, that refers to liquid. So I just want to put mg. Somebody tell me what mg means. I'm going to add that now because I just want to make sure you know that mg and milliliters are two different forms. So milliliter is liquid, and then you got mg. I'll just go ahead and put it here, which is milligram, and that is a solid. Okay, so when you guys are doing those dosage calculations, first of all, you got to get that foundation first, and knowing the difference between liquids and solids, of course. But I just wanted to point that out there, that milliliters, when you're seeing milliliters, they're referring to liquids, and then of course milligrams, you're referring to solid. And then, oh, that's a good one, Nicholas. Thank you. Wait a minute. Let me add MCG. Somebody tell me what MCG. Listen, that's a good one. Thank you, Nicholas. MCG. That is very important. And y'all better not be looking at the answers for the ones that's coming up. I see somebody cheating already. Let me hurry up and hide this because y'all be cheating. Hold on. Okay. Yeah, MCG is microgram. All right, what's L? Y'all probably already saw it when y'all was cheating. You laughing because you probably was the one. I'm messing with you. Okay, what's L? L is leader. L is leader. Okay, what's KG? KG. Yep, kilogram. LB. Yep, pound. What is IV? Intravenous. IM. Yep, intramuscular. ID. So intramuscular, not intermuscular. So remember, intra means within. So we're going within the muscle. Intermuscular would be in between. So inter is in between, and then intra is within. ID is intradermal. K. What does K refer to? And I think this might be the last one. I think this K is the last one, guy. I think. K. Yep, Taylor, it's potassium. You got it. Oh, okay. I forgot I included this. So guys, this is very important. If you want, you can take a screenshot of this. I wanted to point out you will have questions about the do not use list. Well, you may have questions about the do not use list. It is included in practice test questions for the exam, so it may very well be on the actual exam. So go ahead and take a screenshot of this and then study that so you have an idea of what they say don't use. So like you can be mistaken for, O or Z. So they're just basically telling you what you shouldn't use, why it can be a problem, and then this is what you write instead. So instead of writing you or big U or little u, you want to just write unit out. Okay, so right there telling you write these things out. Okay, so even though we know the abbreviations are QD, QOD, and all of that, the Joint Commission says don't abbreviate those, just write them out. Okay, and then you'll see the other ones there as well. So you can take a screenshot of those, so just in case you see that. Okay, guys, this is it for today. Y'all hung in there with me on a Saturday. We've been on here for almost 45 minutes on a Saturday. Oh, yes, CC can also mean cubic centimeters. Yes, that's a good point, Nicholas. Nicholas added that CC also refers to cubic centimeters. And you know what, guys, let me know if y'all have any questions. And while y'all are doing that, writing any questions you have, I'm going to go back and add that cubic centimeters. And then what was the other one? What's another one I need to add that I didn't already have on here? You're welcome, Deidre. What's another one on here that I need to add? I know I need to add PRN, but let me know in the comments if anything else I need to add. Let me go back. I know I need to add PRN. I'm surprised I didn't have PRN. That's like my favorite abbreviation for some reason. Let me add as needed. It was something else I said I was going to add too. I can't remember. We got as needed. And then what else? We said the CC. Thank you, Nicholas. Where's the CC? CC was toward the beginning. Let's see. CC. Where's CC? Where's CC? Let me slow down a little bit. Let me add that in here. So also can mean cubic centimeter. Let me make that a lot smaller. So so that can fit in a little box. So y'all see, this is literally what I do. This is how I create the slides. This is why I started doing more open-ended slides. If you guys notice, if you went through all of my certification videos, you notice in the beginning I was doing multiple choice. Then after a while, I just started doing open-ended. That's because it's so much easier to do open-ended than it is to, because it can be a lot sitting down and creating all these slides. So it's just easier to do open-ended. Let me go back to this. Yes, I'm going live tomorrow too, Kiki. I'm going live every single day this month. With Tiffany, I see she said, Tiffany said that's a good one. Oh yes, I put BID. I have BID on there. Chia said, do you have a set live schedule? I'm new here. Hey Chia, no, I don't have a set live schedule. My life is all over the place, Chia. So I can't even stick to a set time every day. Every day this past week, I did go live at like 6 p.m. or 7 p.m. So, and today I went live at 6 p.m. So I think 6 p.m. is probably a magic number for me. But I do know that some days it could be later. And then there are some days that I may go live right after work in the middle of the day. I know most people will be at work during the day, but sometimes going live during the day is best for me too. Jacqueline says I may have to book a one-on-one with you if you have availability. I need to look at it. Um, so tomorrow, Kiki, tomorrow is probably going to be around the same time as tomorrow. So I'm going to the football game tomorrow. So those of you that don't know, I'm in DC. So we are playing tomorrow in the morning, but the game is over by like 4. But y'all know how traffic is in the middle of a game and all of that. So it's no telling what time I'll get home. So I don't know yet, but tomorrow's live will definitely be around this time or later. And usually I'll schedule it before I go live. So make sure your notifications are turned on because you'll get notified once I schedule it, and then you'll get notified once I'm actually live. Oh, Brianna says centimeter spelled wrong. I spelled it wrong. Thank you, Brianna. Let me go back. That was just a few slides back. Let me just go back. She said I spelled centimeter wrong. Thank you for catching that. Let me see. Centimeter. Oh, no, I spelled that right. Oh, did I spell it wrong on the other one I just did? Okay, let me see. Maybe you mean the other one I just did. Let me see. Oh, okay. I see now. Thank you. Okay, I got you. Thank you for catching that, Brianna. And nobody else was gonna say now. Y'all was gonna let me be out here with misspelled words. Ain't nobody else correct me. I see how y'all do. It be your own people, your own YouTube and Facebook community. I see. Okay. Let me go back here. Okay. Let me go back to the comments and see. You're welcome, Renee. Is there a testing center in Nashville, Tennessee? Yes, the testing centers are all over, Renee. You just have to go to if what test are you taking? So I'll use this for an example. If you're on NHA, when you go in there to schedule, just look for testing sites in Nashville, Tennessee. That's all. But yeah, they're everywhere. Oh yeah, QH4 every 4 hours and QH. Oh yeah, Nicholas, those are good. Yes, those are. I need to add those too. I need to add those. You're right. Um, okay, Kiki says I got notifications on. Tiffany says I take my exam 10/26. I'm watching your videos like it's law. Okay, Tiffany. Good luck on your test. You got a couple more weeks, so don't worry. We're gonna do some more certification videos. And let me just show you. I'm gonna give y'all a sneak peek real quick. Let me show y'all what I was working on earlier, but I may not finish it in time. So I don't know if I'm gonna do this tomorrow, if it'll be Monday, but this is what I was working on earlier. I'm just giving y'all a sneak peek just because y'all in here today. But I started working on some more open-ended questions and stuff. So we definitely want to do some more certification practice. I just don't know yet if I'm going to finish it in time for tomorrow because like I mentioned, I'm going to the game tomorrow. So in the morning. So if I don't finish that tonight, I won't be able to do it tomorrow. But either way, I'll do it. It'll just maybe be on Monday. So we'll see. All right. Um, Kiki says, I'm nervous. Oh, your test is Monday. That's right. I think you did comment that before that your test is Monday. So make sure, Kiki, if you have not already, and this is for anybody that is about to take your test, print, you don't have to print it out, but at least pull it up. Google the test plan for the test you're taking. So like Renee, you said you're taking the CCMA. Whatever test you're taking, just go to Google and go to NHA CCMA test plan. Use it as a checklist. That's how you know you're ready. Just use it like, okay, you're gonna be like, okay, I know this right here. I know this, right? Even like some of the abbreviations we went through today. If you notice some of those you never saw or some of those you're not familiar with, make sure you added those to your notes and become familiar with those. So just use that checklist. Okay, so she said CCMA as well. So just go to Google right now and just say NHA CCMA test plan. Pull it up and use it as a checklist. Purple Skywalker says, OMG, hello, I'm studying for my test and just seeing you live right now. And I want to say thank you so much. You're welcome, Purple Skywalker. You are so welcome. Jalen says, I have my test on Wednesday. Y'all are, man, y'all, okay, right around the corner. Y'all, everybody seems like a lot of people testing next week. All right, guys. So if I don't see any more questions here, I'm gonna get ready to end this. I don't want to keep y'all too long today. It's Saturday. Um, I'm gonna drop the calling link if anybody wants to use it. I doubt it, but I'll drop it just in case. Let me make sure I didn't miss anything. And Jackie, you still on here? Jackie, you don't have to book the one-on-one. I need to go through my emails. You don't have to book the one-on-one. Um, you've already had a couple with me already, Jackie. You don't have to book another one. I'll just have to check my emails. Let me see. I already congratulated Sarah. Let's see who else on here. I know there was a few others that came up. Yvonne, I don't know if you're still watching. Congratulations to you too. Okay, guys. So you all have a wonderful Saturday. I don't know why I feel like today is Sunday. Maybe because I cooked. So yeah, I got up this morning and I made some. I put my turkey necks on for my greens. So I made some greens. I made some potato salad, and I made some barbecue chicken. So I did my cooking today since I'm going to the game tomorrow. And then once I get home from the game, it's going to be about time for me to go live. So I said, let me do my cooking today so I don't have to worry about that tomorrow. So, all right, guys, y'all have a good evening, and I will see y'all tomorrow evening about this time. Y'all have a good night. Love y'all. Miss K, could you do one-on-one for CMA? Please let me know. So yeah, some people that schedule one-on-ones with me, they are also taking a CMA as well. So yeah, if you're taking a CMA, and I'm assuming you're talking about the CMA AAMA. If that's what you're talking about, yes. So everything that I do is all foundational for all of the exams. So if you wanted to do a one-on-one, and let me just put my one-on-one link for anybody that wanted to schedule. So I do a 15-minute phone call. I'm putting that in the chat right now. It's just simply bookwithmissk.com. That's it. And let me I gotta reschedule that group session. So let me remove that group session off there. So if you happen to go to bookwithmissk.com and you see a group, no, let me just take that off instead of even going through that. Yeah, so you are taking the CMA. Yeah, so that's fine. Yep, I've had plenty of sessions with people that's studying for that test as well. One thing too, I want to point out to everybody that may be watching here and anybody that joins my Facebook group. So one of the questions that was in my Facebook group the other day, it said, is this group only about the CCMA? They said it seems like that's all the certifications, that they talk about in here. And I just pointed out that It's not that we only talk about the CCMA. It's just that it is the easiest test to take, and that's why more people are taking it. But no, we are not only, focusing on the CCMA. We focus on all of the certifications. It's just that that's the one that it's just easier for people to take. It's easier for people who have been out of school for a while. It's easier for people who, maybe couldn't pass the CMA or the RMA. And so that's it. That's it. It's not, that's why more people are taking it. Yeah, it's more accessible as well. But yeah, definitely that is not the only certification that I focus on. I'm actually going to get certified through the RMA to be an instructor for simply for the RMA. Even though I already do it, I'm just going to get the certification just so people understand that I do help with that test as well. And I think it's something I can do through the AAMA as well. She definitely focusing on them all. She helped me with the CMA. Yeah, Jacqueline took her CMAA last year. We she did a couple of one-on-one sessions with me to prepare for that. And I do also want to point out, my videos. You guys have my videos. There's a bunch of them. I have the study guide as well. So between my study guide, these videos, listen, I'm gonna make sure y'all have everything you need for this certification exam. Everything. And even not even just for certification, but just, life as a medical assistant in general. I'm just, thank you, Renee. I hope I'm looking forward to it. I haven't been to a game in years. I'm so excited. I'm excited. Okay, guys, let me stop before this get to an hour. We have 58 minutes. I was trying not to hold y'all for an hour today. All right, y'all. Y'all have a good evening. I was about to say happy Sunday again. I'll see y'all tomorrow.